And in the third section of our lecture topic, now we will talk about some vulvar ulcers and swellings. And in this, we will talk about the Behcet's disease and Lipschutz ulcer, manifestations of systemic diseases that can lead to ulcers and swellings, and also different vulval cysts. So vulval ulcers are usually different conditions that can lead to vulval ulcers. We have sexually transmitted diseases, idiopathic. Idiopathic are the diseases in which usually no common cause is known, idiopathic, no known cause. And then tuberculosis, some malignancies also can lead to vulval ulcers, and also some systemic disease related dermatosis or vulval ulcers. So vulval ulcers are present in sexually transmitted diseases like syphilis, herpes, chancroid, granuloma inguinal, and then lymphogranuloma venerea. All these are sexually transmitted diseases that can cause vulval ulcers. Then some idiopathic diseases are which can lead to Behcet's disease. Idiopathic causes is Behcet's disease, aphthous ulcers, and Lipschutz ulcers. These are idiopathic ulcers, disease with no known cause. Then tuberculosis lead to tubercular ulcers. Some malignancies in which we have primary malignancies like squamous cell carcinoma, malignant melanoma, basal cell carcinoma, and then secondary is leukemia and choriocarcinoma. All these can lead to vulval ulcers. Systemic diseases like lupus erythematosus, Crohn's disease, lichen planus, lichen sclerosis, and Sjogren's syndrome. All these can lead to vulval ulcers. So vulval ulcers not only are due to local vulval lesions, they are the result of sometimes as a result of different sexually transmitted diseases, different malignancies, different systemic diseases can also lead to vulval ulcers. Now, Behcet's disease, these are the diagrams of the Behcet's disease, which involve the oral cavity, also the eyes and the genital area. Behcet's disease. Behcet's disease is a chronic inflammatory disease, and it is characterized by recurrent oral and genital ulcers with ocular ulcers. So it involves the genital area, and it also involves the eyes, ocular area. You can see in this involvement of the eyes, involvement of the mouth and the genital areas. Treatment of Behcet's disease is topical. Topical means on the site, on the area, and systemic corticosteroid given by injections or oral. And then systemic immunosuppressants are also used for Behcet's disease. Next, what are some manifestations of patient with Behcet's disease? You can see it's a multi-system disease. It involves pretty much all the different structures. It involves the joints causing arthritis. It also involves in male prostatitis and epididymis, prostate. It can cause genital ulcers. It can involve the kidneys, lungs, eyes, mouth, heart, gastrointestinal tract. So Behcet's disease is pretty much multi-system disease, and it affects slowly all the different organs of the body. Next, Lipschutz ulcer. In this picture, you can see these are the Lipschutz ulcer. They are shiny, raised ulcers in the genital region. Affects mainly the labia minora and introitus. And there is usually lymphadenopathy present with this Lipschutz disease. And it's caused by Epstein-Barr virus. Epstein-Barr virus. Here, picture it's like the picture is more or less like the herpes infection. This is caused by Epstein-Barr virus, and it's shiny, raised lesions or ulcers are present, along with lymphadenopathy, which is enlargement of the lymph nodes. Treatment is antiseptic lotions, ointments are used for the treatment. Next, vulval manifestation of systemic diseases. Some dermatological disorder leads to vulval manifestations like contact dermatitis, psoriasis, and ulceration due to disseminated lupus erythematosus. Then vulval ulceration due to leukemia, acanthosis nigricans, chronic vulvovaginal candidiasis, Behcet's disease, and Sjogren's syndrome. All these are the vulval manifestations of systemic disease. The systemic diseases are contact dermatitis, vulval ulceration due to leukemia, acanthosis nigricans, chronic vulvovaginal candidiasis, Behcet's syndrome, and Sjogren's syndrome. All these can have vulval manifestations. Next is the vulval cysts. Cysts are the swellings that contain fluid. In this diagram, if you see, this is the cyst. It's a swelling, it's a cavity with the fluid in it. So vulval cysts. It can be Bartholin cysts. These cysts develop into the Bartholin glands, which are present on both sides of the vestibule. Sebaceous cysts are the cysts formed in the sebaceous glands. Then we have cyst of the canal of the nuck. So these are the cysts. Sebaceous cysts are in the sebaceous gland that produce sebum. Here, sebaceous cyst. And then this is the sebum. Three types of vulval cysts: Bartholin cyst, sebaceous cyst, and cyst of the canal of nuck. This is the cyst of the canal of the nuck. This is the nuck cyst here. In this, if you see inguinal canal, it has external inguinal ring and internal inguinal ring through which the round ligament crosses. So it's the round ligament in the inguinal canal, and then this is the nuck cyst. This is the parietal peritoneum. Sometimes there is a gap or opening in the parietal peritoneum that goes through the external and internal inguinal ring, and a pouch is formed. That pouch is filled with the fluid. This is known as the nuck cyst. So it's like a hernia. There is a protrusion of the peritoneum through the inguinal rings, and it can cause nuck cyst. Then inguinolabial hernia. Hernia is protrusion of the structure through an opening, and inguinal hernia is common in even in newborn babies. They are born with inguinal hernia, and later on surgery is performed to push the structures or organs that are protruding back. So when the inguinolabial hernia occurs when the entire processus vaginalis remains patent. It remains patent, it remains open, and it is not closed. There is herniation of abdominal contents along the tract. May be limited to the inguinal canal, or may extend to the anterior part of labium majora or labium majus. Or it contents of the sac may be intestine or omentum. So this inguinolabial hernia is formed when there is processus vaginalis that remains patent, and there is protrusion of abdominal contents along with the alimentary tract. So abdominal contents are protruded through the hernia, and they are usually treated by pushing the contents back and by closing the opening or the hernia. Swelling is reducible and impulse on straining can be elicited. Casual surgical incision on labial swelling may cause inadvertent injury to the gut because the organs of the abdomen are protruding through the hernia. So sometimes casual incision can cause damage to the intestine or the gut. Next, vulval varicosities. What's varicosity or varicose vein? Varicose veins are the veins which are not functioning properly. The valves in the vein. Veins have valves, and the function of these valves is to prevent the backflow. So once the fluid passes through the valve, then the valve closes and it prevents the backflow of the fluid or the blood. So what happens in the varicose veins? There is a problem in the valves, and the valves become incompetent and they are not closing properly. So the blood that flows through the brain, it comes back and it causes dilation of the veins, and the veins become dilated and tortuous. So that's the varicosity or varicose veins. So when the vulval varicosity occurs, there is swelling of the vulva and there is pain of the vulva, and it's very painful, tender and swollen condition because of the backflow of the fluid. So that's the vulval varicosity. Next, Elephantiasis Vulvae. Elephantiasis. Elephants are huge animals, so as the name shows, it's the condition in which there is huge area, huge extremities, usually caused by obstruction of the lymphatic vessels or obstruction of the flow of lymphatic fluid that can cause huge limbs or extremities because of that blockage. And the most common cause of elephantiasis is the parasitic infection, filariasis. So elephantiasis vulvae, as a result of that elephantiasis, when there is edema or fluid or lymphatic fluid in the body, it can go back and flow back, and it can even cause swelling of the vulva, and there is vulval swelling. So elephantiasis is a condition in which there is obstruction to the flow of lymphatic fluid or obstruction of lymphatic vessels that can cause accumulation of fluid and it causes enlargement of the extremities or limbs or different organs. So that was all about this section. Thank you for watching sqadia.com.